Walang pangalan. Denominate, no name. Another name, os coccyx. Pag sinabi yung os, okay, it could be a bone or kung isan opening ang ano. Okay? Like internal os, it's an opening. But this one is os coxa means hip. So you have two hip bones here. One sacrum, but this is made up of 5 sacral vertebrae fused, and one coccyx made of 3 to 4 coccygeal vertebrae. And if you have the pelvic bones like this, you can divide this into 2 by means of a landmark there. Call this one pelvic inlet or pelvic bridge. And this is made up of a part of the body of S1, the upper and anterior border of the body of S1 is protruding. And you call this one sacral promontory. And then later here you have ilio-reptilian line and upper border of symphysis pubis. Pangalan? Pelvic inlet. Above it, this is false pelvis. Okay, because this is part of your abdominal cavity proper, right iliac and left iliac region. And then, if you have here the hip bone, this is the body of the pubic bone joined with the other body. Kaya lang, medyo lumaki kasi sobrang daming glue. Okay? This is symphysis pubis. If you have the body there, the pubic bone, this is ramus means ramus of the pubic bone, infioramus of the pubic bone. If you ramus of the pubic bone here, if you ramus of the pubic bone there, this is the pubic arch, which in the male, and this is actually a male, okay, is triangular. Kaya lang sumobra to, kaya lumayo silang dalawa. Sumobra yung glue, okay? So this is supposed to be triangular in the android type, in the male, and roundish in the ideal female, which is the gynecoid type, right? Kung ito ay ramus ng pubic bone, ito naman ay ramus ng ischium. This is ischial tuberosity. This is ramus of the ischium. Kung ito ay ramus ng pubic bone, ito ay ramus ng ischium. This is ischiopubic ramus. Okay? And then you have here the ilium. This is iliac fossa, where you have iliacus muscle. And the superior border here is your iliac crest. Yes. And in front of that, you have 2 spines. Anterior superior iliac spine and anterior inferior. Anterior superior iliac spine is where inguinal ligament will be attached also to the pubic tubercle here. Okay? And this is also the origin of the longest muscle that you have.
Sartorius.
This is anterior inferior iliac spine, and this is the attachment of a iliofemoral ligament of the hip joint. And this is the origin of one of the muscles in front of the thigh, which is your rectus femoris. Okay? So you have here your iliac spines, and the 3 parts of your, what is this? Ilium, pubis, ischium, they join here in what you call acetabulum, which is for enlargement of the head of femur. So you form a ball and socket joint, hip joint. Okay, this one is where they join together. And then you have your obturator foramen. But this one is covered by a membrane. Obturator membrane. But the membrane is incomplete. Obturator canal. And pag nilagyan ng chalk doon sa may obturator canal, there's a groove there. You call that obturator groove. Okay? Kapag nilagay yung membrane, nagiging canal. So meron dito kupa. Okay? You can see that inside. That is obturator, what? Groove. Next. You have here a lateral view. You have here your, what is this? Body of the pubic bone, ramus of the pubic bone, ramus of the ischium, what is this? Ischial tuberosity. Dapat pointed to. So ano to? Ischial spine. So ano notch to? Notch is buka. Okay, what is this? Greater sciatic notch. Ito? Yes, sciatic notch. Eh kung nandito yung sacrum, okay, tapos nilagyan ng chalk yan, tsaka itong spine. Anong ligament? Sacrospinous. Ito sacrum, tapos ito ischial tuberosity. Anong ligament? Sacrotuberous. So you find your openings. Greater sciatic foramen. Foramen is opening. Huwag nyo sasabihin na foramen yan, na pamamalian. It's umupa, it's a notch. Okay? Greater sciatic notch, lesser, kaya lang naging foramen kapag may ligament. Okay? Next. Now here, you have your, what is this? This one is greater sciatic notch, lesser. Dapat ito pointed. Ischial spine. This is ischial velocity. And then of course you have acetabulum here. This one is ilium, pectineal line, right? Anterior superior, anterior inferior iliac spine. Iliac crest is at the level of L4, which is an important landmark when you do lumbar tongue, right? And this one articulates with sacrum, forming what joint? Sacroiliac joint. Okay? So this auricular surface here is for articulation with sacrum. Next. Okay, so you have the sacrum here. It's made of 1, 2, 3, 4, 5. Okay, sacrum. And the intervertebral disc of the upper will be represented by the transverse ridges. Walang intervertebral disc dito. Ang anong between C1 and C2, walang intervertebral disc. Dito, merong transverse ridges. Hindi ko makita. Okay. And you have here, what's this? Anterior sacral foramen, so that the anterior rami of the sacral nerves will pass there. Doon sa pelvic, sa cadaver, hindi natin ganyan, right? Okay, and then you see muscle here. What muscle? Piriformis, arising from the second, third, fourth sacral vertebrae. Tapos may mga nerves na sa ibabaw niya. Ano yung mga nerves? Sacral nerves. That will be forming part of the lumbosacral plexus, where the sciatic nerve originates from, right? Okay, next. You have here the back, and then, of course, you have here the sacral foramen, and that will be for, what is that? That will be for your continuation of the vertebral canal. And then you have your corresponding part of for the spine, and this is median sacral crest. Okay? And you have here your superior articular process, okay? And you have here the laminae of S4 and S5. They are locking here. You find an opening. Kaya lang sumobra dito eh. Sacral hiatus. And there will be two. Kaya lang lumaki. This is just an artifact, no? But there's an opening here because the laminae of S4 and S5 are locking. You call that sacral hiatus. Tapos parang may dalawang horn sa magkabilang sides. Sacral cornua. And then of course you have here posterior, what's this? Sacral foramen for the posterior rami of your spinal nerves. This is auricular surface for the ilium of the hip bone to form the sacroiliac joint. Next. You have here the back. Of course you can, you see it here. Ano nandito?
May battery pa ako.
Ischial spine. Okay? Anong ligament? Sacrospinous. And this is greater sciatic notch. This one is what? Lesser sciatic notch. What opening is this one here? Nandito? Ito artifact dito. Ano to? Sacral hiatus. And you have here two sacral cornua. Okay? You have here what opening? Sacral canal. Okay? Because the dura mater will be up to S2. So your subarachnoid space will be up to S2. Kasi if you have the dura up to S2, ang arachnoid then up to S2. Ang pia hanggang L1, L2, although you have a continuation which is filum terminale. Okay, next. You have here your superior view of the male pelvic organs. Of course, this is anterior abdominal wall. This is rectus abdominis. At the back of the pubic bone, this is the urinary bladder. At the back, you have here your rectum, right? And then, you have here peritoneum, forming the upper surface of urinary bladder. And there is now a pouch there, in between the rectum and the urinary bladder. What do you call that?
Rectovesical.
Rectovesical pouch. If you can see blood vessels here, ito, ano to? External iliac artery, ito, external iliac vein, And the red, small red, and the small blue here are testicular arteries and veins. The testicular arteries are coming from abdominal aorta. The testicular vein, the left will go to, anong vein? Left renal, and the right will go where? Inferior vena cava. Okay? So you have here the scrotum. And that is where you find your testes, epididymis, and then of course, the proximal part of, anong pangalan ng whole thing here? Spermatic cord. What do you have inside? Ductus or vas deferens? We have a better model than this. Next. Okay. Ito na lang. Hot penis here. You have two corpora cavernosa penis. And then you have corpus spongiosum. Ano meron doon? Urethra. Penile urethra or spongy urethra. The other name of corpus spongiosum is corpus cavernosum urethra. Ito naman dalawa na to, when you say corpus, it's singular. When you say corpora, dalawa siya, plural yun. So yung dalawa na to, corpora cavernosa penis. Kasi ito, sa ibang libro, corpus cavernosum din, pero urethra. Ito naman, penis. You follow? Okay, so you have here the scrotum, and the scrotum is where you find the testes, which is producing 300 million sperm cells a day, right? Okay, and this one starts when? Puberty until when?
Forever.
Forever. Okay. Although there will be a difference, no, a slight decline in the quality and quantity when you get older. Pero pwede pa rin. You have here, the sperm cells are not mature, they are not motile, they cannot fertilize the egg. From the testes, right? And they have to mature where? Epididymis, body tail. From the tail, nandun ang ductus deferens, pero hindi nyo siya makita kasi nakokoberan siya ng spermatic fasciae at saka mga blood vessels. Ano mga blood vessel yung red na to? Testicular artery. These are branches of abdominal aorta. Ano naman yung blue? Testicular vein. Kaya lang, ito yung mga testicular veins, right? Kaya lang, yung nandito, yung umpisa, di ba, ang daloy ng dugo sa vein, papaakyat, pabalik sa heart. Yung umpisa, this will be the beginning. And the beginning here, where this is part of your spermatic cord, you call this one piliform plexus of veins. And when this one gets descended, you call this one varicocele. Okay? These are actually just tributaries of testicular vein. Itong mga blue na yan. Now, the testes were there in the abdomen where the kidneys are. Baliktad, kasi yung kidneys during the fetal life nasa pelvic cavity aakyat. Ito naman, testes nasa itaas, pababa naman siya. At bumaba siya, dumaan siya sa anterior abdominal wall, hinihila niya yung anterior abdominal wall para maging wall ng scrotum. Ang skin dito sa abdomen, naging skin sa scrotum. Ang taba dito, ano yung taba? Hampers, naging, ano dito? Cardos. Ano yung susunod? Scarpas, naging oles. So here, you have the skin, tapos ito, wala na. Okay, so, I just instructed them, this must be superficial fascia, right? Kasi wala nang susunod eh. So there will be dartos and coles represented here. And then itong gray, itong brown, at saka light blue, these are spermatic fascia. And then the gray here is what? External spermatic fascia galing sa external oblique. Itong brown na to, ito yung pag na-contract siya, tataas ang testes malapit sa abdomen. Okay? So you have here premasteric muscle, premaster muscle. And this one is, what is the nerve supply sa lumbar plexus? Supplied by genital, femoral nerve, L1, L2, right? Premaster muscle is coming from internal oblique. Itong gray na external spermatic fascia galing saan? External oblique. Tapos yung light blue na internal spermatic fascia galing saan? Transversalis fascia. Are you still following? Okay, so these are spermatic fascia. But then the whole thing, the ductus deferens, plus the blood vessels, lymphatics, and nerves, and then the fascia, ano, pag nilagay nila lahat ito, ano to? spermatic cord. And this will pass in the inguinal canal. And the opening here of the inguinal canal, ito pag nilagay nila ng pin yan, ano yan? Superficial inguinal ring. Papasok na ang spermatic cord doon sa inguinal canal. Okay, next. Next. You have now here, so pag akyat na dyan, at nakadaan na sa deep inguinal ring, ang ductus deferens, nag-iisa na siya. Here. Okay? At lalaki sa likod ng urinary bladder, what do you call that? Ampulla. So if these are the rami of the pubic bone, and this one is levator, honey. Okay? If you have here, natatandaan yung pelvic inlet, tapos alam niyo yung pelvic outlet, and there's a muscle here, what do you call this? Levator, honey. So there's a muscle hanggang dito sa likod. Okay, levator, honey, coccygeus, this is a pelvic diaphragm. Separating pelvic organs with perineum. Okay? And the part of your levator ani that is supporting the prostate gland is levator prostatate. Between the rectum and the anal canal here, this is external anal sphincter, you have your pubo-rectalis part. Right? So, in general, this one is what? Levator ani. Okay? At the bottom of the pubic bone, this is urinary bladder. Yung spermatic cord, pagdating sa deep inguinal ring, nag-iisa na yung, ano to? Ductus deferens. And this one goes at the back of urinary bladder. Of course, you can see here the ureter. And of course, this one here is a peritoneum covering the upper surface of urinary bladder. And this one now covers the upper 2/3 of the rectum. Mula saan ang rectum? S3. Hanggang saan? Levator, ani. How long is this? 5 inches long, kapaka ng trachea. And is it entirely covered by peritoneum? Hindi. Yung upper 2/3 lang niya. Ang low 1/3 is extra peritoneal. It's outside the peritoneum. So yung upper 2/3, yung upper 1/3 in front and the side, covered by peritoneum. Middle 1/3, it's covered in front lang. Ang low 1/3, wala. Extra peritoneal. And what is this pouch here? Which is the most pinakamababang part din ng peritoneal cavity sa lalaki kapag nakatayo. What is this? Rectovesical pouch. Okay? And you have now, okay, so you have your, what is this? And then of course, lateral to the ampulla, what is this? Seminal vesicle. And the seminal vesicle is responsible for 60% of the volume of the seminal fluid during ejaculation, right? And this is responsible for the sticky consistency of the seminal fluid. Malagkit siya because of secretion from seminal vesicle. And this one is rich in fructose. And after ejaculation, immediately the seminal fluid will clot because of the fatty protein coming from seminal vesicle. After 10-20 minutes, this will liquefy because of the proteolytic enzyme coming from prostate gland that you find below the urinary bladder. Okay? So, if you have your prostate gland, okay, you have now your base up, okay, and this one is the apex related with, what is this? The ani. Okay. Make lang a seminal vesicle at ang ampulla when they join, what do you call that? Ejaculatory duct that opens in the urethra inside prostate gland. What do you call that? Prostatic urethra. Next.